Hi, everyone. This is Seth Screamo here again with the Best of Worcester podcast. And today I am at our local Wayne County Health Department with Elise Aiken. She can tell us a little bit about what they have going on there and how she came to be. Elisa, how are you doing today?
I'm doing pretty well. We do a lot of different things here at the health department, but I kind of am the face of the health department. Um, my job title is the Community Health Promotion Coordinator. I also serve as our epidemiologist, where I tell people about um, how many different infections we have. I keep track of that. If something may be foodborne illness, things of that nature. I also am our accreditation coordinator. So we are accredited with the Public Health Accreditation Board. So I have to make sure that all of those documents are completed and done in a timely fashion. I also are our Creating Healthy Communities coordinator. So we have had a lot of fun implementing that new program and that grant where we just started a brand new farmers market in Orville. It started last week. We are a couple weeks in now. It was so much fun working with the people of Orville and the mayor of Orville. And we also, through the Day of Caring through United Way in Orville, have put up the brand new swing set in Orr Park, and we'll be adding to that here soon.
Awesome. Thank you for sharing that. So you're currently the Community Health Program Coordinator for Wayne County. Can you walk us through what that role involves on a day-to-day basis?
That's the fun part about this job is that it's constantly changing. Um, it could be just being at a local event and talking to the residents, telling them what we offer at the health department. It can be applying for grants so that we are staying funded. It can is also all of keeping up with our website, making sure that it's up to date, updating our community health improvement plan, our community health assessment, and serving on lots of different coalitions. So it's a very busy job and it never looks the same.
Yeah, you know what they say, variety is the spice of life. So you wear a lot of hats: epidemiologist, accreditation coordinator, and many more. What part of your job gets you the most excited?
I would say reaching out to the residents of Wayne County, making those connections, working with the many different organizations that we have here. We are so fortunate to have so many organizations that care so greatly for our community and just collaborating with everybody from residents and organizations to make things happen and to try to create a healthier community. Um, that's what the whole creating healthy communities portion is all about. And that's what the health department is. That's our focus is to try to create a healthier community for the Wayne County residents.
Awesome. Yeah, we all need to get a little healthier, that's for sure. So what sparked your passion for public health, and how did your time at WIC influence your career path?
My time in public health started, like you said, with WIC. I worked for WIC for 10 years. And even as I interned, my WIC experience really opened my eyes to the changes that we can do on a larger scale. I liked being able to see the changes from every appointment. We would see parents that were actually listening to the advice that we were giving as dietitians. Um, then I wanted to do more, so I went back and got my certified lactation consultant so that I could help breastfeeding moms also work with them and be able to kind of troubleshoot with them so that they were more successful in their breastfeeding journey. Then through COVID, I saw how important health departments were on a larger scale, and I wanted to do more with that. So I went back to school and got my master's in public health, and my goal is to eventually be leading a health department as their health commissioner. And with the tutelage of Nick Cascarelli, our health commissioner, I've learned a lot about how our health department works from bottom to top, and it's been a fantastic experience. That through and my degree at Kent State have all worked together to really help define what all a health department is, how it works, and really also fueled that fire that this is what I want to do.
Awesome. Yeah, you definitely have to have a strong why. That's for sure. So you mentioned that there were some challenges early on with some hiring freezes and a tight job market. What kept you going during that time?
I just kept pushing forward and hoping that things would change. I see that we are potentially going back to some hiring freezes due to some budgetary cuts. And that's what happened back when I first was started. Um, we kind of went away from the preventative type care, and that's when I first started. So dietitians weren't being hired as much. Now, I think we're kind of starting to get the idea that how we eat and how we move our body is so vital to our health. And so I guess just continue to push forward, knowing that things are going to get better, work through the struggles. The job market will open up again.
Oh yeah, for sure. Sometimes you just got to get through some seasons of life. We'll call it that. So speaking of seasons of life, how did your experience during the pandemic shape your desire to go back to school and transition to a broader public health role?
Seeing how important it was that not only to administer vaccinations, to test people for COVID, to, be that unfortunate entity that was telling you to wear the mask and, to do all the things. But to know that people are not going to trust you unless they know you, especially in smaller areas like Wayne County. We are a close-knit community, and if you're an outsider, you're treated like an outsider. And after COVID, I had seen so many people that were just looked at us as that enforcement agency, and we are so much more than that. We did what we did to try to not only keep people healthy and to keep people safe, but because it was also what we were told to do, what we had to do. And a lot of people didn't understand that. But again, we're so much more than that. We're more than our response to COVID. We offer child vaccinations. We offer child vision screenings and hearing testing and things like the Creating Healthy Communities. Our WIC program, our environmental health program is fantastic too, and they're not just about the enforcement as well. We have a brand new coffee truck that is going to be showing up to the farmers market this week, and they helped them get certified. So, we're out there to help you.
Yeah, I think that there's definitely some misconception when it comes to the government and some of the agencies right now. So what's something that people often misunderstand about public health? And what would you want the average listener to know?
A lot of people think that public health is just one, an enforcement agency, and two, for people of low income. And that is not the case. We're here for everybody. It doesn't matter how much you make, you can come in and get vaccinations from us. We have different plans available, and we're not just enforcement. We're also about education. We're very, very much education strong. We do education for sexually transmitted infections. We do education for drug abuse. We do educations for falls prevention for our senior population. We're one of the leading counties actually in senior falls, and falls can be very deadly. So we, with the help of Holmes County, have implemented the falls prevention program. We do education for nutrition. through our dietitians at WIC, as well as I'm a dietitian. So as the community health promotion coordinator, I can come out and speak to your agency. I can come and talk to your school. I've done several nutrition educations through the Worcester High School. And those are things that we enjoy doing way more than we enjoy enforcing things.
Oh yeah, education's huge. And you shared that public health is about treating the community, not just the person. Can you give us an example of a project that reflects that mission?
Yes, I think the creating healthy communities right there is a great uh, example because we're treating the entire community through a brand new farmers market. We're treating the entire community through uh, the renovations in Orr Park. We also plan on expanding that to Rittman next year. And then other potential places are Dalton and Apple Creek and also Worcester. Those are the other areas that we're looking at for there. Also through the Narcan distribution, that's not just going to individuals, but that's going to agencies as well, making sure that our police departments, even West Salem, are all armed with Narcan because it's not just the drug users that we have to be concerned with. It could be a child that got a hold of something at the park. It could be your elderly grandmother who forgot that she already took her Vicodin 3 times and decided to take it a fourth, and now she's having an overdose reaction. Things like that. Making sure that our entire community is armed with safety for their health, for their, preventing disease, all of that.
So from food safety to Narcan distribution and emergency readiness, there's a lot your department does. What's one initiative that you've been especially proud of?
Obviously, I'm proud of the creating healthy communities, but I have to give props to our community health program. Their Narcan distributions have skyrocketed. We gave out over 3,500 Narcan kits last year. And that probably doesn't mean a whole lot until you look at the other facts. Our death to overdose ratio went up 3 times what it was. That means that how many people overdosed per one death increased. We were saving lives. Bottom line, we saved lives by distributing the Narcan. And I know that it's a very controversial subject. There's a lot of people out there that do not agree with it. My big thing is sometimes you have to save people long enough till they realize that they need saving, and then they save themselves.
Oh yeah, definitely. I think everyone deserves a fair chance for a good life. Um, how do you personally stay sharp and continue to grow professionally in such a dynamic and demanding field?
I enjoy meeting with other colleagues. I read up on the newest trends through journals, through online websites like the CDC and the Healthy People 2030. I'm constantly looking for new innovative ideas as to how to bring programs and educations to our residents and just staying active and collaborating with other different types of entities. As a registered dietitian, food is my thing, but talking to nurses, talking to physical therapists, talking to doctors, all of those are fantastic avenues to collaborate and come up with new plans.
Oh yeah, collaboration's key when you're trying to do something. Try to do something by yourself. It's hard. When you have other people, it makes it so much easier. So what are some ways you and the health department engage with the community outside of this office? And for those of you that are in this office, it's super pink.
Yes, pink is definitely my favorite color. I was super excited to move into the new building and be able to decorate it as I wanted to. And I have windows. Our last building did not have any windows. It was very depressing. We do a lot of things outside in the community. Our community health program, they have a mobile unit. And if anybody is interested, all you have to do is give us a call and ask for Patty, and she would be more than welcome to talk to you. And we can even bring that unit out to schools and things like that to get your children vaccinated there in your community, at your workplace, things of that nature. We also are doing a community health fair, which we offered last year for our first time. So this is our second annual community health fair where you can come to the health department. We're going to be here for 4 hours on a Saturday, and many, many different organizations will be here. We had 34 last year, and I believe I already have 20 signed up for this year, and that's going to be in July. You can also find us at the county fair. We set up booth there as well, offering freebies as well as your blood pressure, different things like that. You'll also see us at other health fairs that are offered throughout the county. I was at anybody from Creston would know about the ox roast that we have every year. I was there last year. Um, and I was right next to the Creston Police Department. And then I was also at Orville's Home for the Holidays, which is also another huge event. So yes, you look around, and if you want us at an event, give us a call. We're more than happy to show up. We also, our community health and FEP, as well as myself, were at the Amish Safety Day too. So
Awesome. So you mentioned the community health fair and creating healthy communities. How did those come to life, and what kind of impact are you seeing with those?
the community health fair was kind of it started with an idea that I had, and I went to our health commissioner and said, "Hey, all these other places have health fairs, but we are the health department. I think it's time that we start offering one." And he said, "Go for it." He loves it when his employees are inventive and show initiative. And it was a huge success. We had over 100 people walk through, and we had 34 different organizations outside of the health department. And so this year we've decided to go for it again. The creating healthy communities, how that started, I was looking for grants, trying to bring in some money, and saw this grant come through. Again, I went up to Nick and said, "Hey, I love this. This is right up my alley as a dietitian. What do you think about applying for it?" And he said, "Go for it." So we did. We were awarded $95,000 for a 5-year, and that's each year for 5 years. And unfortunately, a lot of that has to go towards um, personnel and things like that, but it does give us about $30,000 that we can put straight back into the community, which is fantastic. And they're also, that personnel is helping to make these things happen. So as you can tell from in my office, there's lots of farmers market things, just from that one piece of it. So, and it's been exciting. It's been a whirlwind.
No, it's definitely awesome seeing like an idea, a spark, and then it becomes into something like bigger than what you can imagine, right? So speaking of things that are bigger, what are the biggest wins or changes you've seen since taking over on your current role?
Some of the biggest wins, I think, would be just being able to make this role into a role that fits me. And being allowed to do that, and having the ability to be creative, and having that fostered. That it's so telling when you can be yourself and also be productive in helping the community. I've thoroughly enjoyed every bit of this role. I enjoy all the different aspects of it, meeting the residents, meeting different people to collaborate with, being on different committees, and seeing how much people actually care about the residents of Wayne County. It's absolutely fantastic and energizing.
Yeah, I think we definitely have a very giving community. Last year I did some stuff at the library, and I had a pretty good turnout from it. Didn't really expect anything in return, but it always feels good to plant a seed and see how it grows, right? So speaking of planting seeds, in 5 years from now, you said you love to serve as the health commissioner. What do you feel makes that dream so meaningful for you?
I feel that I am a leader, and I want to be able to lead as I have been led. Um, Again, fostering that idea of allowing people to be creative and to assist in making a better community, a healthier community. And I can't wait to be able to put all of my knowledge, my hard work into practice and helping others to become leaders as well. And leadership doesn't have to just be being in charge. Um, Currently, I have no underlings. I am not in charge of anybody, but I have been able to spread my wings in leadership through the Creating Healthy Communities grant, through the uh, health fair, things like that. I've been able to show leadership, express my leadership, and been very inspired and thoroughly enjoyed it.
Now, you gave credit to a lot of your team and mentors. What role has community and mentorship played in your growth?
Community and mentorship is so inspiring. My I've mentioned Nick a lot in this. He's been a fantastic mentor. He really cares about the residents of Wayne County, and he cares about his employees as well. And that is especially evident in some of his practices and things like that. Um, our community health director, Patty, she's absolutely fantastic. She has helped mentor me in many different aspects of community health. That's not my forte, and she's helped kind of guide me as to what they do and what they offer and things like that. She's a fantastic leader, has some great innovative ideas. Our director of finance and HR, her and I have been talking a lot. Teresa is fantastic at helping me to learn the financial aspects of the health department, things again that I had never dealt with. And Wendy has some amazing creative ideas as well, and she's our WIC director. And Vaughn is anybody who knows Vaughn. Vaughn is Vaughn. Vaughn is our director of environmental health, and he is just absolutely a light. He comes in and he's always got a smile on his face. He leads by example. He's a fantastic director, fantastic person, and I've known him as long as I've been here because he's been here longer than me. Um, so he's very inspiring and has been a huge form of support as well. Actually, that's how we got connected was Mr. Von Anderson. And the community has been so supportive. The different coalitions that I work on and many different teams, when I make the statement that I had gone back for my master's in public health because I want to take a larger leadership role in public health as a health department commissioner eventually one day. No, I'm not trying to dethrone Nick. Don't anybody think I am. But they've all been very supportive as well. And, let me know how I can help. So, yeah, it's just been a great experience. I love Wayne County.
Yeah, I think it's very important to have people that speak life into you, right? So, speaking about speaking life, what advice would you give someone listening who might be curious about entering the field of public health?
If you have no experience in public health, come see us. We are very open to having interns or somebody shadow. If you're interested in working for WIC, talk with Wendy. She'd be glad to have you come in and shadow. If you're interested in becoming a public health nurse, talk to Patty or follow some of the sanitarians around through Vaughn. I'm sure he would be thrilled to have you there too. Let us know if you're interested and do it. I'm not going to tell you that you're ever going to get rich for working with public health, but I will tell you that the rewards are amazing. The financial rewards may not be there, but it is a great field to get into. And even if you only change a few lives, those are few lives that have been changed. Just like with the Narcan, we saved lives. We absolutely saved lives. When I worked as a WIC dietitian, I could see parents changing the way that they fed their children to make them healthier. And that's changing lives. That's making a difference. Every person that you can smile at and know that they are living a little healthier because of you. That's fantastic.
Awesome. So those are all the serious questions. Now we're going to get into the fun questions. So let's start where we might find you on a Friday night. You said you love Spoon. Why?
That was actually a really hard question to answer. Um, because I don't go out to eat very often, but the last place I had gone was Spoon. And I will say that I had a blast. They actually had, I've always liked Spoon, uh, but never thought about going there for dinner until my husband had suggested it. I always go for lunch because I work here in downtown. And we went and they had karaoke that night and just had an absolute blast. It was so much fun.
What's your go-to karaoke song?
Hmm. Um, let's see. Probably Black Velvet would be one of them. And then if I'm trying to anger my husband, he doesn't like it when I sing angry music. So then it would be something by Alanis Morissette if I'm trying to anger him.
Gotcha. My wife loves Any Man of Mine. Yeah, we had a wedding we were at out in Colorado, and we were at a bar there, and yeah, she sang that, and I was like, "Yep, that's her to the T." So you mentioned that one of your favorite movies is The Princess Bride, which is a classic pick, by the way. What do you love most about that movie?
I love the humor in it. It still cracks me up how many years later. And it reminds me of I'm an only child, so I adopt people as my siblings. And I had a younger brother sibling that could literally quote the entire movie from beginning to end. And it still makes me smile anytime that I think of him quoting it. So, and it was something that I shared with my family. And now I share with my adult children.
So last question here. I love ending these episodes on a very positive note. What's the best thing about your life right now?
So many things. Family. Family is definitely the best thing. I am blessed with 3 amazing children that keep a smile on my face, keep me laughing, keep me grounded, and aren't afraid to tell the truth when I mess up. And my middle child has actually given me 2 adorable grandsons that just are the light of my life. I have amazing parents that support me in everything, and my husband is absolutely incredible and is there whenever I need him, and even when I don't need him, he's there. He's there right beside me. He's fighting with me the good fight, and I'm just very, very fortunate.
Awesome. Well, thank you so much for being on the show today. It's good to know what all good the Wayne County Health Department is doing and some initiatives that are going to be showing up here in the summer. If you need any contact information from the show, you're welcome to reach out to myself, Seth Screamo, at 330-221-1547. Thanks. Have a great day. Bye.